Effect of treatment. Chemotherapy is designed to target cancer cell. However, it can also damage healthy cells, resulting in an array of hematological and non-hematological toxicity and other complications that range from mild to severe. It's like the way we were talking about leukemia. So we are saying there are some severity that can be brought. So now, if you want to treat now those severity, now that's the reason you are giving supportive treatment. Also, I think even here you can give supportive treatment. One of the side effects is, these side effects include myelosuppression, chemotherapy-induced nausea and vomiting, mucocytic fatigue, infertility, and graft-versus-host disease. Now we discuss each one of them. The first one is myelosuppression. It's a decrease in the patient's healthy blood cell. There are three basic types of myelosuppression that may occur as a result of treatment. One is anemia. Low number of RBC resulting from low hemoglobin can cause shortness of breath, tachycardia, or fatigue. Patient may need blood transfusion or hematopoietic growth factor to manage this anemia. Example of those hematopoietic growth factor is like the epoetin. Thank you. These growth factors are usually given subcutaneously on a weekly basis to stimulate the production of the RBC in the bone marrow. That is anemia of the myelosuppression. The other one is thrombocytopenia. We know what is thrombocytopenia. Put patient at a risk of bleeding or bruising, and they may require platelet transfusion to maintain an adequate platelet count. The other one is neutropenia. Put the patient at a risk of infection. Patient may experience fever or chill and will need to be closely monitored and treated if fever arises. Lymphoma patients often receive myeloid growth factor as part of their treatment regime. So those are the supportive treatment. This drug helps to stimulate the bone marrow to make more WBC. These drugs are given subcutaneously with each dose of chemotherapy to help increase WBC count, thereby lowering the risk of infection. So that one is myelosuppression. The other one is chemotherapy-induced nausea and vomiting. Chemotherapy-induced nausea and vomiting can be one of the most significant toxicities associated with cancer treatment, affecting numerous aspects of the patient's quality of life and potentially altering the course of therapy. Fortunately, increasingly effective anti-emetic agent and combination of expanding clinical treatment options for the treatment undergoing chemotherapy. The key to minimize chemotherapy-induced nausea and vomiting is prevention, as well as adequate protection throughout the course of therapy. Patients should also be encouraged to meet with a dietitian so that they can receive guidance for maintaining nutrition while undergoing chemotherapy. Other integrative therapies may also be helpful in managing chemotherapy-induced nausea and vomiting. These include self-hypnosis, Reiki, massage therapy, acupuncture, or acupressure. What is Reiki? Yes? Me, I don't know too. That's the reason I'm asking. So if you don't know, we are a group of good. It's a good to know. Okay. Then kukona mucocytic. Occur when the lining of the gastrointestinal tract is destroyed as a result of therapy. The patient may experience sore in the mouth or gastrointestinal tract that affect the ability to eat, speak or swallow. There are multiple treatments available to manage mucositis, each such as dietary suggestion, salt water rinses, or prescription medication. So that one is like una relate both the after this cause, how can you prevent this side effect, or how can you treat this side effect. Then the other one is most patients with cancer feel fatigue sometime during the course of treatment. The National Comprehensive Cancer Network defines cancer-related fatigue as persistent, subjective sense of tiredness related to cancer or cancer treatment that increases with usual functioning. This sense of tiredness is usually not relieved with rest and is not related to an excessive amount of activity. Many patients describe it as a feeling bone tired. They may feel physically, mentally, and emotionally drained. Mild to moderate exercise has been shown to improve fatigue in patients undergoing treatment. One of the interventions that has been proven very effective is large clinical trials to relieve or prevent fatigue is correction of anemia. So if you have anemia, it can lead to fatigue. Why?
Because of low blood oxygen.
Because of the reduced number of RBCs. Other strategic for helping patients manage pain is increasing activities. Studies show that patients with cancer who exercise are less tired and depressed. They also sleep better than patients who do not exercise. A referral on physical occupational therapy can be very helpful in providing practical tips for patients regarding exercise and energy conservation. Eating well. Many patients experience treatment-related nausea and vomiting as well as decreased appetite. Patients should meet with a nutritionist to discuss tips to ensure that they are getting enough calories, fluid, protein, and other nutrients to help them prevent fatigue and increase energy. Psychosocial support. Activities such as relaxation, counseling, support groups, and biofeed can decrease fatigue. Therapies that aim to educate patients about fatigue and related factors help reduce fatigue. Sometimes depression and anxiety play a part in the symptoms. It is important that this be addressed as treatment may help in overall fatigue management and improve the patient's mood. So when we talk about fatigue as a diagnosis, can we say fatigue related to inadequate psychosocial support?
Specific
Yeah. But maybe we can relate it here. We can say fatigue related to insufficient psychosocial support. Kwa hii statement we can say it like that. Thank you. Rest. It is important to save person energy. Encouraging patient to ask. Hakuna.
Nasikia kucheka. Sicheke tu. Malize. Alafu ndio endelee.
Pass a rest. Yes. Yes. Sorry.
Reiki. Is an energy?
Healing technique in which the masters who has undergone formal training in this healing art. This is gentle hand movement with the intention to guide the flow of energy.
Okay. Why? Then there is something else we can do. How we can prevent fatigue is rest. It is important to save person energy. Encouraging patients to ask for help from friends and family allow them to focus on the most important thing, that they need to be done. Distraction. Patients should try escaping from their fatigue by doing things they enjoy. Activities such as reading, watching TV, or a funny movie, or doing a craft may help in fatigue management. Sleep therapy. Many patients with cancer suffer from disrupted sleep pattern. Having a regular sleep-wake pattern will help improve sleep. Using relaxation method, limiting caffeine to the morning, and keeping naps short will also help. Now number 3, we were talking about the side effect. Sawa? Now the other side effect is patients with lymphoma who undergone treatment may experience infertility. Fertility preservation techniques such as sperm banking and egg preservation should be discussed with patients prior to the initiation of the treatment, because chemotherapy and radiation therapy can cause birth defects. A discussion regarding the use of birth control must occur prior to the start of the therapy. Asking patients whether their family is complete is an important question. Umesikia? Watu wa nani? The other one we are talking about is graft. It was graft versus host disorder. Yes?
What? Good.
Yes.
Confirm.
Ni graft versus host
Graft versus host disease.
disease.
Graft
Yes.
versus host disease.
Disease.
Sawa.
Sawa. We continue. Ni vipi doro? Let's continue. Let's be serious. What?
Infertility
Yes.
leads to lymphoma.
Lymphoma. No, how does lymphoma cause infertility? This is because the chemotherapy and radiation. See, when they are
Birth defects.
yes, they
But
cause,
lakini haiwezi cause.
it can cause infertility.
It's because I think we have said that the chemotherapy
Yes.
is destroying both the healthy
Yes.
and the non-healthy cells.
Yes.
Yeah, so I think all the cells, I mean, we know that maybe something like the sperms, those are cells, the ovaries are
Yeah.
cells, so they're going to be compromised.
Yeah. So this so this one is graft versus host disease can occur after allogeneic transplant if the host bone marrow that the graft identify the recipient bone's marrow host as a foreign and therefore attack the graft tissue. Yes.
Anasema sometimes men who have lymphoma have fewer sperms in their semen. It's not then possible to store the sperm, but there's a new technique to help men with low sperm count. It's important that you discuss sperm banking with your doctor before the treatment starts.
Yeah. Sawa. So before you undergo a chemotherapy, you must first of all confirm. The doctor can ask you some question whether your nini is complete or it's not complete. All right. Reaction. Now we continue. Reaction can be mild to severe and are managed with medication that decrease the immune response. Symptoms of graft versus host disease may include rashes, diarrhea, and mucosity. Nursing management.
Atijili unasema ground ama grand.
Graft, yeah. Nursing management, that was side effect and how you can manage them. Now the nursing management, first thing you monitor respiratory status and provide supplemental oxygen as necessary. If lymph nodes of the neck and chest are involved, patient may experience shortness of breath, dyspnea, and airway obstruction due to obstruction of the trachea or inferior vena cava, because we say the lymph node will going to swell and they can block, ama they can obstruct, ama they can narrow because yeah. Not changes to the skin color, pallor, and cyanosis. 4. As the white blood cell multiply rapidly, it can reduce the oxygen carrying capacity of the RBC, resulting in hypoxemia. So you know they are going to be overflooded. They are going to flooded. Yeah. Observe for neck vein distension, headache, dizziness, facial edema, dyspnea and stridor. Lymphoma patients are at a higher risk of vena cava syndrome, in which the superior vena cava is obstructed from enlarged lymph nodes. This constitutes of a life-threatening emergency. Emergency radiation treatment may be ordered. We are okay. Assessing and manage pain. Teach relaxation technique, administer analgesic as necessary. Now the analgesic that you can administer here is morphine, tramadol, Pivydin. Najua mimi I have those no wonder I'm asking. Well, manage now when the enlarged lymph nodes are usually painless, patient may experience pain with radiation or chemotherapy treatment. Management of pain and reduction of stress is essential to patient to improve hearing and conserve energy. Nutrition education. Monitor daily weight and caloric intake. Encourage patient to eat more frequent meal and increase protein intake. We are good on nursing management. Yes. Patient may experience lack of appetite and diminished nutrition. Increasing caloric intake, promote hearing, provide fuel for energy and prevent gastric distension. Offer more palatable options frequently. Provide supportive comfort measures following radiation or chemotherapy treatment. Patient often experience extreme fatigue, nausea, and vomiting following treatment. Assist with
Activities of daily living.
Yes, activity of daily living. Offer ice chips and antiemetic as appropriate for nausea. Assist with positioning and monitoring skin for breakdown. Fatigue and impaired nutrition cause muscle weakness. Assist patient to position of comfort for optimal air exchange and monitor skin for sign of breakdown due to prolonged bed rest. And with that one, I would like to end my reading there.